No more breast hyperplasia. First of all, we need to know that breast hyperplasia and breast hyperplasia are different. Breast hyperplasia is not a disease, but a state of the breasts. The symptoms of breast swelling and pain that women experience before menstruation and which resolve spontaneously after menstruation are breast hyperplasia. This is a physiological manifestation, not a disease. After each menstruation, the levels of estrogen and progesterone in the body begin to rise in preparation for the next menstrual period. At this time, the cells in the breasts also begin to proliferate with the rising levels of sex hormones, until the estrogen and progesterone levels reach the level before menstruation. At the peak of menstruation, breast tissue continues to proliferate. When estrogen and progesterone levels drop, menstruation begins, and at the same time, breast tissue begins to regress, that is, it returns to its previous state. Breast hyperplasia refers to the fact that the breast tissue still proliferates after menstruation and cannot rejuvenate or is incomplete. This results in pathological hyperplasia, and only then can it be called a disease. Breast hyperplasia, also commonly known as breast adenosis, fibrocystic breast disease or fibrocystic changes of the breast, is a benign disease originating from abnormalities in the development and degeneration process of the breast. The disease is mainly related to endocrine dysfunction, including an imbalance in the ratio of estrogen and progesterone, abnormal quality and quantity of breast sex hormone receptors, elevated prolactin, etc. It may be affected by factors such as age, menstrual history, pregnancy history, and breastfeeding history. It most commonly occurs in women aged 30 to 50, and 70% to 80% of women will have varying degrees of breast hyperplasia. Breast hyperplasia, mainly manifested by three main symptoms and two auxiliary symptoms. The three main symptoms include breast pain, breast lumps and nipple discharge. 1. Breast pain. It can manifest as breast swelling, tingling, throbbing pain, burning pain and tenderness. It often occurs in one or both breasts, with one side being more severe. The pain often appears or worsens a few days before menstruation. 2. Breast lumps. Lumps can appear as pieces, nodules, cords or mixed shapes. They often vary in size, have unclear boundaries, and are tough or hard in texture, and can be moved when pushed. The lumps have the characteristics of enlarging and hardening before menstruation and shrinking and softening after menstruation, which is not the case with other breast disease lumps. 3. Nipple discharge. It occurs in about 5%-15% of patients. It is usually porous discharge and the color is often milky, straw yellow, yellow-green, etc. The two major auxiliary symptoms are mainly menstrual changes and emotional changes. If you have irregular menstruation, early menstruation, wrong menstruation, less menstrual flow, incomplete menstruation, light or purple menstruation, it may be accompanied by dysmenorrhea. Emotionally, there are often chest tightness and discomfort, irritability, etc.